Hello everyone, this is Sami, your host, with a new topic today on the webinar. Uh, I'm welcome you all, behalf of my whole team, and behalf of myself, and behalf of our today's guest, Miss Nadia Jawida. I will start with the webinar topic. The webinar topic is role of neurolinguistics, programming, and diagnosis of depression, anxiety, and personality disorder. Our today's speaker, Miss Nadia, is from Algeria. I will go with a short introduction. She is a researcher in neurolinguistics, okay, for the Department of English at the University of Jilali LIABES, Algeria, and the teacher of foreign language specialized in ESP Terminology English and foreign languages. Graduated from the Faculty of Letters, Arts and Human Sciences in Algeria. Graduated in Communication in International Relationships and Trade from the University Paul Valéry III, Montpellier, France. She is currently the head of Consulting and Coaching Foundation for Training, Rate, and Personal Development. As a public speaker, Nadia has hosted many events both in the Philippines and Europe and abroad, and has been invited to speak at various international platforms on topics related to communication, linguistics, education, and research. And one more thing which I want to add here, that Miss Nadia was also our guest, a very honorable guest in our few back previous webinar, and she's a great personality as well, and she's very much intelligent and a great researcher as well. So as the introduction of the speaker is completed, I'm going to tell you something about our webinar sections. Those who are very much familiar with us don't know that we go with the three sections. But for those who are very much new, I want to repeat each and everything. As we all know that we have three sections in our usual webinars. And in first session, our speaker came and gave a presentation on the topic for the 40 to 45 minutes usually, but sometimes get over that as well. So after the presentation, we will go with our today's guest. As you all know, the person or the candidate or the viewer who is very much active in our webinars, we put and we select him as our guest in next webinar. So from you peoples as well, if someone will be very much interactive and very much intelligent and very much questionnaire in the comment section or will active, we will give that person the opportunity to be our live guest. So we will take our guest live on with us, and he will ask two questions from our today's speaker. When she will complete his answers of his questions, then we will take your questions. That is the third section and the final section, and very much important for those who are willing to get the certificates as well. So you all have to remain here with us to get the certificates. You will be here with us for the final session. What will happen that final session? In that final session, Miss Nadia will answer all of your questions. Your questions regarding this presentation, your questions regarding this topic which Miss Nadia will present. So when she will complete the answer of your questions, and then I will also send the link of your feedback form in middle of that section. I can send that link in start, I can send link in a letter, or I can send that link in the end as well. So I request all of you to not comment that send the link, send the link, send the link. I will send it on the time. So what is the feedback form link, and a few precautions which I want to give you. If you are logged or if you are viewing me through the browser, just make sure to sign in your Google Chrome account. If you are on the Google, or if you are on any browser, just try to sign in first. And if you are viewing us through the YouTube application, also sign in there. If you are not signed in, you can view us, but you can't view the comment section. So if you can't view the comment section right now, try to sort it out before the final session of the webinar. In that feedback form link is actual for you, and you have to copy that link and paste in the browser and fill the feedback form. What is feedback form? Feedback form is actually make you enable to get the certificate. Those who will not fill the feedback form will not be able to get the certificate from us. And don't message us that we didn't fill the feedback form, or this thing happened, or this thing happened. If actually any error occurs to you, if you are very much correct and error is again happening to you, Take a screenshot of that error, mail us, WhatsApp us, or Facebook message to us and ask us to send your certificate other than that form as well. So thank you. This was the 3 sessions which I shared with you, and the very much important thing, because I have very few candidates in start, like about 30, and those will also join. A few will also join after the time. So, but I want to give you that information in start, and I will also share this in last as well. Actually, we have a series of webinars with Miss Nadia, and this is not only the one webinar is with Miss. Madam will also present very what we can say scopable topics in front of you of the linguistics in next weeks as well, because she has prepared a very good package for the audience, and she will present all the topics. And if other than that topics, you have the topics which are very much closer to the linguistics or the field of Miss Nadia, you can text us those topics, and if we are not going to arrange the webinar, we will try to give a 5 to 10 minutes recorded video to you on that topic as well. So Miss Nadia is here to guide you, to teach you, and to give you as much as she can do for you. So we will have this series of the webinars, and those who will be regular in our webinars, and we will see that yes, this person has attended all of our webinars, we will give him a great certificate along with an opportunity, and which is a gift, and the gift will be shared later, that what is that gift we are going to share with those who are regular in our all of the series of Miss Nadia. So that's all from my side. Thank you. Now I over my processing to my Miss Nadia. Thank you, ma'am.
Thank you very much, dear host of the Universal Webinar. It's really a pleasure. Good morning, everyone. Thank you for joining us today in this very hot day in Algeria. So to explore this important topic about neurolinguistics, programming and its issues, development. Together, as in this seminar, I'm very excited to be hosting this event, and because I feel that these projects deserve attention and time. So let's start with the first slide of our work. So neurolinguistic programming in mental health diagnosis and also in care. So what is neurolinguistic programming? What is our objective? Why are we learning it? Why are we investigating in that field? So the aim and the objective of the study is to analyze the problem first. So through the process of questionnaires, some specific questionnaires through neurolinguistic programming in the mental health diagnosis in order to identify the mechanism of these questionnaires. So, and the solution is to promote better communication by the use of the NLP, neuro-linguistic programming, as a tool in mental health care and during the psychotherapy sessions. And believe me, trust me, you are going to discover it later that both of the problem and solution are inside you, are inside us. So what is neuro-linguistic programming? Let's start with the definition. So in very recent study, so in 1975, Grinder and Bandla discovered that they have a particular way of proceeding that allow them to obtain surprising results from their interlocutor. So they wanted to capture the essence of these interventions so that they could be passed on and many people could benefit from them to reach the desired results. So this main goal of NLP is to study and to investigate on this mechanism, how it works, which help the person to widen his or her range of behavior, to better understand our reactions, to change them in order to develop them, and more adapt one. Let's start with the very beautiful quote of Buddha. All what we are is the result of what we have taught. We are our thinkings. The mind is everything. So what we think, it's what we become. So what is NLP? Sure, it's an acronym, NLP. So neuro is related to the thinking process of the mind, the way we use our 5 senses according to the VACAG model. So V is for visual, A for auditory, K for kinesthetic, of olfactory and gustatory. So that is to understand things which are happening around us. L for linguistics refers to the linkage between language, which is the main tool of communication and interaction with ourselves and also with others, how it influences us and those around. P for programming, it's our behavior toward the way we organize ideas and actions which produce expected and also unexpected results. There are too many concepts, so we cannot be practicing such heavy mechanism without coming back to theory and to concepts. The first concept of the meta programs of NLP is the beliefs. Beliefs are basically assumptions that we make about the world and our values seen from those beliefs. It's our education, environment, family, experiences when being a child, the perception of experiences we lived before, and the choices we made during our life. That's what we call the map. The map. Each one of us has a map. And my map is different from yours. My map is different from the map of my brother, of my mother, of my friend. So the beliefs are the main and the first concept of the NLP. To the value continuum. Values are fundamental to our decision and behavior. You can find it in education, in your parent education, school education, and all the environment of education when being a child. So, and their meaning varies from a person to another, and from their meaning varies according to the people and culture that influence them. You know that there are many cultures around the world, and these cultures are going to shape our thinking, which are going to shape our behavior, and at the end to shape our personality. So the memories, you will know the person's internal resource and richness can be used to create new highlights with new possibilities. For example, if the person is able to use his or her imagination to create new resource state, he or she can produce as needed. And finally, the decisions. NLP decisions-making strategy incorporate these true senses from the vacuum that we see before into the process of our decision-making. You know, everything is linked, including your visual senses, auditory senses, and kinesthetic senses. When you incorporate all these senses into the decision that you make, you are likely to make the better choices, believe me. So this is the word. What is the map? Many of you are asking this question inside their head. So what is the map? So you have the world, which is surrounding us, out there made up of subatomic particles. So the input absorbed by the body and the mind through the five senses is going to pass through neurological filters inside the mind. Internal image, sound, feeling, emotions are the first axis. Then two linguistic filters, because we need words to express themselves, to express what we are looking to, what we are hearing to. So this is going to shape the linguistics map. It's a conscious mind description. So through the behavior program, what we result is the output. It's our speech, it's our actions, it's our attitude, it's our perspective. So this is the map. So we must have some research questions that we are going to develop together through this project. How does the neuro-linguistic programming operate as an effective model for clinical diagnosis, care, and personal development? 2, what are the mechanisms of the NLP communication model? And 3, how does neuro-linguistic programming operate as a meta model to attempt the map of beliefs in order to change them for a specific goal, in order to feel better? The hypothesis varies. Neurolinguistics programming is taking advantage of his psychological axis since he involved and continues to be enriched in investigation. It's dynamic. In mental health therapies, neuroscience, professional development, coaching, training, education, philosophy, and spirituality. The use of the meta model as a set of questions, because we are going to develop this set of questions, specific questions, later on, to specify information, challenge and expand the limits of a person model of the word. It responds to the deletion, distortions, and generalization in the relation of the conversation you are having with another person. We all use communication to interact, even with ourselves. A map is not the territory it represents. It means that our beliefs that we have enriched in our childhood through our education, parents, culture, religion are not the territory. The territory is the truth, and the map is our beliefs. So the map is not the territory, which means that our beliefs are not systematically the truth. So, but if corrected, it has a structure similar to the territory. If we think about our language, at best they should be considered only as maps. A word is not the object it represents. A language also that particular self-reflexibility. You know, the door behind me is the door. We can close it to have some privacy. We can open it to get out. But it also, linguistically, it can be also, I open the door. It's like I found a solution. I have been illuminated by a solution of a problem I have. You know, this is the self-flexibility of language that allows to be analyzed by linguistic means as such as neuro-linguistic programming, the field in which we are investigating. You know that 792 million of people are suffering from mental disorders in the world nowadays. Only 3% of this big and huge number are going to public health resources and mental health. 1 in 4 families suffer from mental disorders in the world. We have to think about this category. If you ask me, what is the mental disorders? So the type of mental disorders according to the DSM-5. So what is the DSM-5? It's the Bible of mental health. It's the Diagnostic and Statistical Manual of Mental Health Disorders. We are learning and working with the 5th edition, DSM-5. So the type of mental disorders are, first, the mood disorders like depression or bipolar disorders, anxiety disorders as number 2, personality disorders as number 3, schizophrenia, bipolarity, etc., eating disorders, anorexia, etc. So substance abuse disorder like drugs, alcohol, psychotic disorders like schizophrenia, post-traumatic stress disorders are going to develop later on, and obsessive compulsive disorders. This is according to the DSM-5. So, how to use this model of NLP? Through the vague model, which is our 5 senses in order to reach objectives. So, the step 1 is to use visual, auditory, kinesthetic, olfactory, and gustatory senses. So, in NLP, the senses through which we experience the world are referred as to be representational systems. Hence, you have several different systems working for you. You have your visual for things you see, auditory for things you hear, kinesthetic, things you feel, you touch. It's tactical sensation. ADR, self-talk, also called labeling system, olfactory, things we smell, and gustatory, things we taste. This is the Van model. So you have the 5 senses above. This is the experience of our world: visual, look and see, auditory, hear and listen, etc. And how do we use our 5 senses in order to change this map? We have to talk about it, this map of belief that may be wrong and which cause this trauma and cause these mental disorders. We are here to help you to feel better, to heal from this. So we use the experience of the world as a system: primary representational system, people who feel colors, see and talk to themselves, people who take information through their eyes, ears, hands, bodies, and emotions. So the neuro-linguistics programming techniques, how they use, how the therapist and the psychiatrist, the caregiver, the nurses, the coach are using this technique is by these three main processes. Anchoring, it's training your mind to trigger certain emotion when seeing or sensing an external object or sensation. For example, look at an image when you feel happy. You might be able to change future emotion just by looking to this image. Rapport, mimicking speech pattern or physical behaviors of others to strengthen and communication bond. And visual kinesthetic dissociation is through an exercise that involves reprocessing a past event from detached, dissociated viewpoints. Here you should know about dissociation. How the professional is going to attempt the mind of the person, the mind of the patient, the mind of the person who is struggling and suffering in his life is to ask questionnaires. So what are these? There are many questionnaires using in the mental health and in the psychiatric field. But the most common ones and the most used one are the HAD, Hospital Anxiety Depression Scale. It's a scale because we are going to score your results in order to study them and give you the result, the diagnosis. And the MDK, Mood Disorders Questionnaire, these are the most common assessments. So this is the basic model of the Hospital Anxiety Depression Scale, HADS. So have a look of a question. Most, I feel tense or wound up. You guess that each response has its own score that we are going to calculate at the end. You can do it at home. This is available for you because this work are going to be shared at the end of the seminar. So look, you can do the quiz with your friend, your partner, your colleague, your classmate. A lot of times, 2 points. Most of the time, 3 points. Another question. I cannot and see the funny sides of things. As much as always, 3 points. Not at all, 0 points. So the scoring at the end, you are going to be checked by the professional. So the total score, D for depression, A for anxiety, from 0 to 7, it's normal. 8 to 10, borderline, abnormal, borderline case that we're going to develop later in the mental disorders types. And from 11 to 21, abnormal case. This is for the scale for anxiety and depression. And this is the mood questionnaire is for personality disorders. Have a look of the first question. Has there ever been a period of time when you were not usual self? And I'm quite sure that each one of us has been in this state of mind at least once in our life. So you were so irritable that you shouted at people and started fight or arguments. You were more talkative and spoke much faster than usual. You had more energy than usual. So the response are yes or no. By scoring the response, the number of yes and the number of no at the end. So you will discover if there is no problem in your life, your health, your mental health is okay, nothing to fear, minor problem, moderate problem, and a serious problem. Here you must go to see a professional in order to help you to diagnose your mental health disorder and to help you to feel better, to heal you. So when I have been at the psychiatric hospital of my city, Sidi BOURASSI, here in Algeria, I have been placed at the psychiatric hospital thanks to the team who are watching us today, and thank you for them. We have elaborated, because you know, this series of questions, HAD or MDK, they need time to be submitted to the patients. So we have elaborated commonly with the psychiatric team a questionnaire which is going to help you, you as researcher, you as being interested in this field, to know the purpose and to discover the purpose of each question. So if the specialist is going to ask you this question, have you ever consulted before? So the person and it is the calibration, is the first technique of NLP. It's looking for psychiatric history that is of greatest importance. If he is going to ask you the question, what do you do for a living? Is to evaluate the patient's professional life, failure, success, the relationship of the disease with the professional life, repercussion, and the opposite also. So if you have been asked one day in your life about, do you sometimes feel depressed? Is to explore your mood. Do you sleep well at night? You know, the goal is to explore the instinctual functioning number one. There is three different functional, intellectual functional: sleep, food, and sex. So does your head works a lot is to explore the ruminations that we find a lot in the anxiety case. Do you feel that people talk about you and have changed about you? Is for the same objective, is to identify and to make the diagnosis of agoraphobia, is the fear of people. So have you ever consulted for other illnesses? Is to search for somatic diseases, pre-therapeutic advices. Another questions, what year it is for your time orientation. Have you ever thought about ending your life? Is to look for a suicidal risk, and it's very important to be sincere by it. Don't feel shameful to answer to this question, because it is very important for your future health conditions. And how are you eating this day is to evaluate the second instinctual functioning, which is food, and how is your relationship with your spouse partner is for your second, your third and last sensing instinctual functioning, which is sex. So the results of investigation on a sampling population of 100 patients is that depressive disorders is about 29%, anxious disorder, anxiety with its different levels, it's about 18, both 31, and personality mood disorders, it's about 22. This is the results. So now let's speak about the solution suggested by the psychiatric team department. For the anxiety disorders, medicine and therapy from 1 to 2 years using NLP as help in the healing process and not in the diagnosis process. Personality disorders, psychiatric therapy from 1 to 2 years, and post-traumatic stress therapy group, therapy discussion group from 7 to 9 months. So our findings that argue that NLP has been less widely studied than cognitive behavioral therapy and even mental health medications. In one hand, this could mean its effectiveness is rated. So on the other hand, it could be that researchers don't deem it promising enough to spend time and money assessing it. We are inviting mental health centers to invest more money and time in coaching the caregivers, psychiatric, the nurses, and also the psychotherapists in order to enhance their abilities in practicing this innovating and efficient model. That is to reach objective by offering the opportunity, time, and space to the patient suffering from mental disorders to communicate. Because if he do not communicate, how can we understand them? How can we analyze his behavior, his speech? How can we discover his mental health disorder? So time and space to the patient suffering from mental disorders to communicate, to tell his story, because all it's about story of our life. 2 directive questions, HAD and MDK questionnaire, a person struggling with trouble to communicate rather than prescribing medication which may affecting him more than healing him. So less medication and more communication. It's my advice. So according to Robert Dilts, a very famous linguist and practitioner of the neuro-linguistic programming, NLP is described as the analysis of the interactions between thought and that build the function of the body and the related linguistic behavior. NLP is a collection of constructive thoughts that involve different aspects of human functioning and organization. Therefore, several factors come into play the action and their purpose. The motivations for these actions is our identity and our vision of the world. In NLP, visualization and objectives are very, very important. So thank you for your consideration and attention to this matter. And now I am welcoming with a great pleasure all your questions dealing with the different aspects that we have exposed together.
Thank you, Ms. Nadia. That was
Thank you.
very much useful and a great presentation. And hopefully the audience has get a lot of from it, and will also show that in the comment section as well. So now
I hope it's so.
we are just going to add our today's guest. Give me 2 minutes only. So I request all of the audience, as our guest is going to join us soon, you all are just requested to create your questions and paste them in the comments and send them to us, that we can also shortlist the questions and get them on the screen as well. Miss Nadia, are you there? I think Miss Nadia has lost her connection. I think Miss Nadia has lost her connection. I request all of the audience to stay with us for a few minutes to reconnect Miss with us. Give me 2 to 3 minutes to contact her. Yeah, as our today's guest is with us, Mr. Wakar Mahmood, I welcome him with my heart and soul, from myself and from our today's speaker, as well as from our audience. Welcome, Mr. Wakar Mahmood from the Okada. And
Thank you so very much for inviting me.
thank you, sir. Thank you. I'm really sorry, sir, that you are here, but our speaker has just lost her connection and she's trying to join her again.
Okay, fine, no worries. It's fine, it's okay.
So I request all of our audience to stay here with us. Ma'am Nadia is going to join us soon. She has just texted that she is reconnecting and will join within a few minutes. All those people who have the questions, like Miss Rimsha Parveen and others, they can post your questions. I will take your questions to ma'am as well. And other than that, those who are asking for the PPT presentation and the feedback form link, the both will be shared with you. And for the PPT, I will request you all to email me or text me who needs the PPT, because we don't send the PPT to all. We only send to those who need it. So you can text us about the PPT that we need it and send to us. And just give us a few seconds only to reconnect our today's speaker. I'm really sorry for this all inconveniences. Welcome back, Miss Nadia. I think you lost your
Oh, sir.
connection.
Sami, I'm so sorry. We have been interrupted. So here I
That's
am
okay.
once
That's
again.
Yeah. So our today's guest, Mr. Wakka Mahmood, is with us. He's from the Pakistan Okada. He's a professor in linguistics. And now I over the proceedings to Mr. Wakar Mahmood, and he will now question from you, ma'am. Thank you.
Uh,
Thank you very much.
First of all, thank you so very much, ma'am. It was really a very informative session. Really, we learned a
Thank you
lot
so
out of
much.
it, and it was really a sort of innovative topic. And I must say this thing that it was a really very informative session. We learned a lot of out of it. Ma'am, am I audible to you? Am I
Thank you
clear to
so
you?
much. I'm very happy to hear that.
Yeah, ma'am, as far as your presentation is concerned, so my first question from you is that, like, why is it important? Why is it necessary to understand the linkage between the mind and the language? I mean, like, why is it important to understand the linkage or the relationship or the association between the mind and the language? Please let me know.
Thank you for your question. So you know that the mind holds a very strong relationship with language, which take as well as display disparate strata of meaning and significance. So language itself is the main tool of interaction and communication even with ourselves. So it's the tool which is connecting us with the world which is surrounding us. So you know that language is something that we cannot touch. We cannot it's something of not touchable, it's invisible, it's impalpable. So the language is the embodiment of the human mind. So this is the linkage. It's through language that the mind comes out. How can I know that you feel good, mister? Now, is by asking one of the question of the hard questionnaire scale of anxiety and depression. How do you feel these last days? So the human mind is going to comes out through language to get introduced and to be understood by the outer world. So this is why psychotherapists use language by this set of questions. There are many skills to discover and to do the diagnosis of the mental health disorders. And one of the most popular one is the HUD and the MDK questionnaire. So we use language to try to came out with your beliefs, with your state of mind, in order to know what is happening to you and to know how to help you to feel better. Thank you very much for your question. I hope
Okay,
that
thank you.
you
Yes,
find
I
the
have.
answer of your
Yeah, that was a very
interrogation.
pretty good answer. Thank you so very much for it. I would like to have one more question from you, respected madam. The question is that, ma'am, do you think that our beliefs or our memories of the past, these also affect our level of perception? I mean, how we are, perceiving the things. Do you think that our memories of the past, our prior experiences, our prior knowledge, this is having certain impact or influence on our the way we are actually decoding the messages? Please let me know, ma'am.
Okay, taking notes. Thank you. So, thank you for your very interesting questions. So, you know that the beliefs is one of the concepts of NLP. As we have seen in slide number 3, that the main concept of the meta programs of NLP, the first concept is the belief. So you know that when others who have experiences maltreatment, for example, I'm going to give you a very simple example. So adults who have experiences maltreatment as being child, you know that this trauma, this bad event, this bad experience, even if they are witnessing this trauma, not experiencing them itself. So they are going to be traumatized by people. They are going to develop what we call in one of the type of the mental disorders, agoraphobia. It's the fear of being with people. It's the fear of being in front of a person. Is that permanent need to stay at home. So if you stay a lot at home, you are going to develop depression with different levels, suicidal ideas, dark thoughts. So this trauma is a stimuli less comforting than people that had not experienced trauma. So when you feel a trauma in your life, you are not going to grow up the same as the people as a person who has lived any trauma is his life, and how lucky they are. And they also maintain a greater social distance from others, and they are going to develop some problems in order to find a job, to be integrated in such a community, to develop relationships, in order to get married, to be happy. And I hope that you find the answer of your question in my response.
Okay, thank you so very much, madam. It was a very clear answer.
Thank you for your interest, and thank you for joining us today. Thank you very much.
So you can go with the third question as well.
Okay, fine. I hope so. I must go ahead with the third question as well. Okay, ma'am. My another question is that would you please let me know regarding post-traumatic stress in very simple language, in very easy and plain language, that what is meant by post-traumatic stress? Because right now we are having several students with us, so I just want this specific terminology, post-traumatic stress. I mean, a very easy interpretation, a very easy understanding to what is actually meant by post-traumatic stress. Yes, madam, please.
Okay, thank you for your question. So, you are dealing with very, very common mental disorders in the psychiatric daily life. So the post-traumatic stress disorder, it's what we call in the psychiatric terminology PTSD. Maybe you ever heard this acronym before in your life, in reading an article or joining a seminar. So it is post-traumatic stress disorder. It's when your mental health condition is pushed by a terrifying event that you lived in your past, not necessarily in the childhood, even in your at the high school, at the university, at your work. So even if you are witness of this, so the symptoms are very, very, very current. It's some flashbacks, always thinking about the same thing, to be obsessed by these dark thoughts. It's nightmares when you're sleeping at night. It's severe anxiety. It's very high level of anxiety, as well as you cannot control thoughts by the events. You are always linking your thoughts to these events. And you know that the reaction of the human body, it's one of the, the genius of creation. So your body is going to be conditioned to this state of mind. So it's going to develop what we call in psychiatry and psychotherapy the 5F. You know what is the 5F? Is when you develop a systematic response to this trauma that you live in your past. So this 5F is the fight. The first reaction is fight. You are always fighting and struggling with people. You are a nervous person. The second fight is the flight. So and fight and flight, freeze, flight. You are conditioning your body, reminding this trauma. Your muscles are rigid, and we see it. We can see it. Even if we are not a psychiatric, a psychotherapist, a professional in NLP, a linguist which is investigating in neurolinguistics, we can see it. It is very, very clear and very visual. You are freezing yourself. It is a body condition in order to preserve yourself, because your mind is going to say to your brain, to your body, freeze yourself in order to protect you, because he is thinking that the same trauma is going to happen. It's, I face people when being there, facing that problem, and it's very sad. That's why I have been always integrated in that field, because the first purpose of NLP is to help people and to see them feeling better. The flop, you are like floppy, and finally the friend. You are always calling a friend, even in the middle of the night. One of the question of the Indica questionnaire to make the diagnosis of personality disorders is: do you speak at late at night, like 3 a.m., 4 a.m. to friends. And that is the purpose of calibration process of NLP, is to see if you have one of these F, which are going to help the psychiatric and help us as being investigator in that field to know that you are suffering from this post-traumatic disorder, mental disorder.
Okay, very well explained. Thank you. Thank you so very much. Thanks a ton, ma'am. It was a wonderful
Keep in your mind the
explanation
5F.
Yeah, 5F. That is a bit tricky
Yes.
and complicated. But apart from this, this is an interesting one. Thank you so very much.
Thank you so much for your participation. Thank you.
Thank you, sir. Thank
have
you very
been
much,
very
sir.
lovely.
And thank you, ma'am, for being very much answerable to sir. And sir, thank you for joining us. Hopefully, we will have many sections with sir with you in
Thank
future
you,
as
thank
well.
you so much.
Thank you so
Thank you
much.
very much,
Thank
sir.
you for
Thank
the
you very
guest.
much.
Thank you.
So, ma'am, now we are going to take the questions of our participants as well. Just let me see who has put the questions or comment them. Ma'am, here is the first question. Ma'am, here is the first question for you on the screen.
Yes. It's a question from Aisha Abbas, who is asking, what is the role of neurolinguistic in the language acquisition? And thank you for this question, because I'm in love with this topic. So you know that there is two very important poles in the process of how do we acquire the word when being child, when being baby at a very early age. You have the input and you have the output. So the input is all the data and the information which are going to be learned from a baby since a very, very, very young age to help him to understand what is this word which is surrounding him. So the family, the school, and the environment are very, very important in the life of the child or the baby when he is acquiring language. The choice of words, the choice of beliefs, the choice of terms that we use to communicate with children are very important, because when we speak about neurolinguistic programming, what does it mean? Is the selection of typical and specific words in order to interact with a person, even with a child, in order to have the results. So if we are going to enter a good data in the brain of a child during his language acquisition, you are going to be resulted with surprising and positive output, which is a good belief, self-confidence, self-esteem, respect of the environment, respect of nature, facility in order to communicate with people. If he is communicating well with people, he is communicating well with his teacher, he is communicating well with his classmates. So all these mechanism of good communication, it's going to help him to rise normally and to be a very normal adult, who is going to reach his goals, his expectations, and also his dreams. Why not?
Thank you, ma'am.
Thank you very much for your question. I hope that I have been helpful.
Hopefully, ma'am. This is the ma'am question. I don't know what is language is used. Can you please identify the language?
What does it mean, Prigma?
Yeah, I think this is another language, and we couldn't.
How neuro-linguistic? I think that he is meaning programming. So in my country, Philippines, mental health is greatly overlooked, unfortunately. So do you think that NLP can one day be internationally standardized to help countries in similar conditions, like like mine. Thank you very much for your question, because your question is related to my findings and related to my recommendation when I was doing my thesis about neurolinguistic programming, and when I have been involved during my placement at the psychiatric hospital to be in direct contact with patients, to hear their story, as being, I was a student of English, so I had to have, like literature, in Jews, American literature. I'm always linked to this part of emotions and feeling. Maybe my perspective when being there in the consultation wasn't the same as the psychiatrist, who is very professional. I was always looking to their face. I was always looking to their to reach their emotion. How do they feel like being, when being mentally dysregulated? So this is a part of my recommendation. I said before, please train the specialists. Please give time to the psychotherapist. Please invest money in this process, which is very, very helpful, because it gives time to the person who is struggling with one of the mental disorders that I had explained before, to know about his story. And if you have enough data and enough information about what he is living, what is in his mind, sure, you can help him. Thank you very much for your question, because it is linked to my recommendation part. Thank you. So how linguistics therapy shape or adjust our life change objectives? So that, as Buddha said, the first beginning of my presentation, I spoke about what Buddha thinks about this power of thinking, shaping our personality and our belief. I'm going to give you a very, very simple example. Let's take an example of a girl who is living in a very specific area in the world. So this girl has been influenced by very specific beliefs that if a girl is loud, it is not a good behavior. So if you speak loud, because girls and women must speak not loud, so you are going to rise up with this idea that you don't have to raise your voice, because if you raise your voice, it might be considered as a sin in such religions. So if you don't, if you have to develop this fear of raising your voice, and this girl has studied very interesting studies, has been graduating for a very famous and important university, and she's found a job. And in the job, she's a manager. She's, for example, a communication manager, and she has to do meetings to make meetings. So if she don't raise her voice, so how can she be efficient in her professional life? So how these beliefs are shaping our personality. She's going to be a shy person and develop this fear of speaking in front of public, which is one of the mental health disorders, as the DSM-5 has proven. Yes.
Here is another one for you, ma'am.
How can a person who has trauma could face he or her fear in his influential journey to adulthood? Yes. So as I said before, you are not obliged to experience a trauma. You can only be a witness of a bad experience to be traumatized by this event. Even if when you are a child during your childhood. So this is the role. You have faith. So in order to help you to manage it and to live with it, a trauma can never be forgotten. So if you are going to go to a coach which is practicing NLP, and he's going to tell you, yes, you know, after 5 sessions you are going to be to forget all about this trauma, he's lying. We are not, you know, a very close person to me working for the mental health field said to me one day, you know, we are not here to make them forget their trauma. We are just helping them to manage it, to live with it, you know, to have good relationships and good future. And thank you for this person very close to me, because it was like the revelation of NLP. So try to manage yourself through NLP, through session, to psychotherapy, to go if you feel that this trauma, it has a bad result and a bad negative and negative consequences in your daily life, relationship, work, even when being in public. Just go to see specialists in order to get help. You can make the quiz at home after finishing our webinar. You have the HOT scale, you have the handicap scale. Just do it. The scoring are real, you know, because it has been set by the mental health university specialist. So just do the quiz and the scoring. If you have such abnormality in your scoring, try to see a person who may help. Thank you very much for your question. I really appreciate.
Ma'am, we have another one on the screen.
So can we say that yes, is the flashback of a bad happening? Yes, of course. Yes, of a bad happening. Yes, it's a trauma. It's a trauma. It's a trauma. When you say post, it's coming after the trauma. Maybe not systematically, not automatically, not after the directly after the happening of this trauma, of this bad experience that you lived in your one day in your past. So it can be how to say stimulated by an event. I can give you a very beautiful example. I met a doctor. She's a doctor. She's a very lovely person when doing my placement. She's a doctor. You know, she has been she lived a rape. She has been sexually traumatized by this event. She was a child. She has been abused by her uncle. So her conditioning of mind kept this trauma inside her head, freezing this bad experience in order to not think about it, in order to don't feel it, to have it in her mind. And you know, one day she was dealing with a course at the University of Medicine about legal medicine, and they were talking about sexual abuse, childhood sexual abuse. So it was the stimulus. So after this course, she discovered that she was struggling with this souvenir, and she started to be seen by specialists, which in order to help her to manage this trauma that she experienced when she was 12. And don't worry, she feels very good today, and she's carrying on with her studies, and she become a very, very beautiful and successful doctor. Thank you very much for that.
Yes, ma'am. The other one is on the screen. After that, we have the last one, maybe.
Yes. How about those people who can communicate perfectly in a sensible way, but that suffer from mental disorders? It is possible scenario. Yes, of course, it's a possible scenario. The reason why specialists in the psychiatric field have created these very specific scales and questionnaire in order to find the dysregulation in the speech, even if it is perfect. Even if they speak 5 languages, they have high position in their professional life, that there is, believe me, always a gap. Thank you very much for this.
Here is the second last question. It is from the Salman Sumro. I just want to add that he's a very much regular viewer of our webinars and he's a great student. So here is his question.
So neuro is related to the brain, to the mechanism of the brain associated to beliefs, making choice, about value continuum, about memories, because when you are thinking about a trauma that you lived when being a child, so there is a specific process which is happening in your specific parts of the brain, which is going to came out with this bad souvenir throughout nightmares, throughout specific appearance, face expressions. And psycho, it's always related to behavior. It's a behavior analysis of the attitude.
Yes, ma'am. So this is the last question, ma'am. Then we are going to end
So
our
it
today's
is
session.
the use of the hospital anxiety and depression skills. This is my response to this question. And you can do it, Miss Shevana Jaira Hermes. Just do it. So just try to get the questionnaire from my PPT. Mr. Sami is always sending the feedback of the webinars to the participants. Just do it. Just give yourself 5 minutes and you do it. And then, according to the scoring, you may have an idea about your mental health conditions. Thank you very much.
Yes, ma'am. So, ma'am, this is all from today's questions.
Thank you very much. Thank you very much. The audience was very dynamic, and thank you for all their questions. And thank you, Mr. Sami, for giving me
Thank you very much, ma'am.
opportunity to present my findings.
Actually, this was honor for us to have you here because you are very much intelligent, and we were planning to get
so
this
much.
webinar. And hopefully, we will do many webinars. We have only Eid break in the next week.
I'm available. Just ask me, and I will be there.
Hopefully, we will be there. So I request all of the audience that they can join us in the next webinars of Miss Nadia as well. As I have already explained, I am repeating. Those who will be our regular viewers, we will not only give them this certificate, we will give them another certificate of the series viewers. Other than that, we will have a gift for them who will be our regular webinars. And the gift is very much secret. We will share that in the last of the series. Thank you, ma'am. Thank you very much.
Thank you, Sami. See you soon. God willing.
Good morning. Thank you, ma'am. So I have shared the feedback form link with you all. You all can just go with the feedback form and fill it. Here is the example of feedback form link. Just go on to it. The feedback form link is already shared. So don't text me that we haven't received the feedback form link. I am also commenting that feedback form right now. If you are not finding the feedback form link, just sign into your account and then get the feedback form link. And Miss Trisha 𝘆cie𝘂'𝗹𝗹, I will request you and Miss Aisha Abbas, you as well, to email us or message us. You both are selected as our next guest. And along with you both, Aliza Shahid, you are also requested to contact us through any of the medium. You three peoples are selected as our next guests. If you are willing, then you can contact. I request Miss Aliza Shahid and Miss Trisha Andrea, and the third one was, I think, Aisha Abbas. Now you three are requested to contact us. You three are selected as our next guest. If you are interested, you can contact us. I repeat, you three, Aisha Abbas and the Aliza Shahid, and the last one is from the Trisha 𝘆cie𝘂'𝗋𝗋. You three are requested to contact us through any medium, email, message, or WhatsApp. you three are selected as a guest. Email us or message us with your name and the matter that we have selected you, the host has selected you as a guest. Our media team will communicate with you for the further information. Thank you all. I'm going to end this section now. If you have the people any have the question, you can contact us and comment me right now. I'm giving you only 2 minutes to share your question if anyone wants to ask anything. And other than that, if any other people who is very much intelligent and who is very much who feels that he or she should be here with us live as a speaker or a guest, I also say you that share our email or message us that you want to be a guest, you want to be a speaker, or whatever you want to add with us in the this section, knowledgeful section, you can do so. We will consider your request. We will ask you about your qualifications. Especially the professors and teachers are always welcome to be our guests. And for the copy of presentation, just email us or message us. Ms. Trisha Andrew, if you are also willing to be our guest, you can also text us for that and email us for that as well. And you can also message us as well. And for the email, you can go our Facebook page. Okay, link is already given in the description of this video. If not in this video, of the other videos, you can search on the other videos description. There will be the link of our Facebook page, and there you can message us. I'm also going to share you my WhatsApp, our WhatsApp number. You can also contact us on that WhatsApp as well. I think each and everything is clear now. No question or the confusion from you peoples. I haven't received any message, so I'm going to end this webinar today. Thank you very much. Thank you all to join us. And the last thing I want to repeat here, those who haven't subscribed our channel, just go and subscribe, because if you haven't subscribed the channel, you will feel difficulty to get the certificate. Our media team will recheck each and everything. So if you haven't subscribed the channel, subscribe it and to get the certificate. I repeat, you can subscribe the channel and get the certificate. And the last thing for you all, that be with us in our next webinars as well, because there is a gift for you and another certificate of the series for you. Thank you very much. Thank you all here to be with us. Thank you all.